Hi, I'm Simon Setti, Director of Operations and Urgent Care at Yeovil Hospital. We've been on a real operational journey over the last couple of years, and I hope you enjoy this video that showcases some of the great work our clinical teams have led to improve the quality of care here, particularly in ED, to improve flow through the hospital, to reduce cancellations and ultimately make it a more enjoyable place for our staff to work, a more productive place, and to really improve the quality of care.
I'm John Tipping, I'm one of the ED consultants and I'm also the Clinical Director for Emergency Medicine. We had some problems with our triage times, which were averaging approximately 20 minutes. And we also had some problems with overcrowding in the department at peak times. We addressed the triage issue by a small building project which essentially doubled our capacity for triage and has reduced our triage time to approximately half of what it was before. We've also looked at our rotas, both medical and nursing, and matched the staffing levels to the more peak periods, and that has included putting emergency medicine consultants on the shop floor until 10 p.m. at night. This has had a very significant effect on our performance against the 4-hour standard with a good improvement. These are things that we change within the department, but I think there's also been a significant effect from outside of the department. And a big part of that is that the trust management see the ED standard as a trust standard and not an ED standard. And they've supported us in achieving that by making significant improvements in patient flow.
My name's Julie Reeve, I'm the Consultant Nurse for Emergency Medicine and I oversee the new Ambulatory Emergency Care Service, or otherwise known as AEC. We developed this area because of the pressures on triage and general overcrowding in the emergency department. So now all the patients that are referred in by their GP who are clinically stable come into this new clinical area. So this has lots of benefits, like I said, for triage and overcrowding, but also it cohorts all the patients on who may be suitable for ambulatory pathways all in one place so that they are ambulatory until proven otherwise, with our aim to prevent admissions. On an average, we prevent between 150 and 180 admissions a month. We also provide an early facilitated discharge project, which patients who are clinically unwell at the start of their journey into the hospital and are admitted, at some point during their ward stay they become clinically well. They then might be discharged down to ambulatory emergency care and we finish off their management plans. And this has a general benefit for the whole organisation, helping patient flow.
Hi, my name is Mandy Carney. I'm Head of Patient Flow here at Yeovil District Hospital. That means I'm responsible for patients' flow throughout the hospital from admission to discharge. The success has been because we've engaged the wider organisation in our strategic vision. We have a different focus on a daily basis looking at patient pathway. We're encouraging our multidisciplinary teams to be less tolerant of delays. If patients require a scan or need to be seen by a specific consultant, then it's in our gift to be able to do that, and we should ensure that happens, and patients shouldn't wait for internal diagnostics or reviews. In addition, we do have obviously a cohort of patients that can't return to their normal place of residence and need some support with that, or need rehoming. So therefore we work really closely with our social work team and our external providers at community hospitals, and daily we review this cohort of patients. This in turn, with minimal delays through every patient's pathway, means that we've always creating capacity for our ED patients to come into hospital where they need to receive their acute treatment.
We hope you've enjoyed this video about the great work our clinical teams are doing here at Yeovil. There's a lot more to do and a lot more we will do over the coming years. And sadly, we've not been able to show you all the examples of things going on, and we really rely a lot on our community and social care partners to progress things. But what does it mean, the work we've done? Well, it's helped us run a more productive hospital, first of all. We've saved over £1 million by cancelling fewer elective operations. We've saved £900,000 by using fewer escalation beds. But most importantly, and I hope you've seen from this video, it's a more enjoyable place to work, and crucially, it provides better experience for our patients.